Hello, so today I'm going to be talking about the limbic system as my favorite brain part for this presentation. I know this is not one structure, it's multiple structures working together, but it's part of the reason I chose it. So the limbic system is not, as I said, it's not just one structure, it's multiple structures, and it tends to affect our well-being and plays a big role in who we are. It is also known as the emotional brain. And I tend to be a very emotional person, which is one of the reasons I chose it and find it interesting because it can explain a lot about things I do every day and how my brain works. So, kind of the basic information, the structures of the limbic system include the amygdala, which is fear, kind of deals with like fear and aggression. It's an almond shaped kind of area of the brain, is how many people know it. And then the hippocampus is memory consolidation and spatial navigation. So it kind of deals mostly with your memory. The thalamus is the relay center of sensory information. So it works mostly on like having information come in and then sending it where necessary. And then the hypothalamus regulates basic drives like thirst and hunger and sleep. So these aren't all the structures, but these are kind of the main few that are usually talked about the most. So, common disorders tend to be depression, anxiety, Alzheimer's disease, and schizophrenia. So, there's a definition for all of them. Most people know what depression and anxiety are. They've unfortunately become more common as time has persisted. So, usually in the limbic system, a lot of the disorders can be mental disorders or mood disorders. But with Alzheimer's, it is the progressive and irreversible brain disorder that causes a gradual decline in cognitive functions such as memory, thinking, and reasoning. So you tend to see Alzheimer's as some people get older. It you don't see it very often in like younger populations and ages. And schizophrenia is a chronic mental disorder characterized by significant disturbances in thought, perception, and behavior. And then what I'm mainly talking about today is two different, more rare disorders that aren't talked about a lot, and I didn't know before doing this presentation. So, the first rare disorder is limbic encephalitis, which is inflammation of the limbic system. So, some of its symptoms include memory loss, seizures, confusion, sleep disturbances, and personality or behavioral changes. So these affect like memory loss affects an area of the brain limbic system like the hippocampus, sleep disturbances like the hypothalamus, and personality or behavioral changes are more affected in the amygdala. And it's diagnosed by imaging, lab tests like a cerebral spinal fluid tap, and EEG. And then the one I found more interesting was the Kluver-Bucy syndrome. Sorry if I didn't say that correctly. So what it is a neuropsychiatric disorder caused by bilateral damage to the temporal lobes. So this could happen from something less common like herpes simplex encephalitis or something that tends to be a little more common, unfortunately, like trauma and stroke and Alzheimer's. So some of the key characteristics that I found interesting in like symptoms were hyperorality, which is increased like drive of exploring objects within the mouth, hypersexuality, which is like increased drive of inappropriate sexual behaviors, visual agnosia, which is difficulty recognizing objects visually, placidity, the loss of normal fear and anger responses, and interrogated amnesia, which we talked about in class. So treatment wise, there tends to be no like overall cure, but symptoms are managed through medications like antipsychotics, antidepressants, and like different mood medications, and then different types of therapies like cognitive behavioral therapy. And then the structures mainly affected include the amygdala and hippocampus. So I found these to be kind of more interesting disorders that aren't talked about a lot and you don't see very often. Yeah. Thank you.